Gossip.
This is Polyp Gossip, the place for physicians and patients to catch up on what's hot and what's not in CRS with NP or nasal polyp syndrome.
This podcast is developed by Sanofi Regeneron and also elaborated in close collaboration with EUFOREA. Welcome to all to this next episode of Polyp Gossip, which is all about smell and what it means to lose your sense of smell. You may know in the meantime the initiative of Polyp Gossip, which is all around talking with experts about the disease, what it means of having the disease, and how we can tackle this disease in the best possible way for both patients, as well as looking at this disease from a physician perspective. This is a unique initiative by Sanofi with support of EUFOREA, and that's why I'm so excited that we bring some of the relevant topics to the larger community. And today I'm very excited of having two experts in the field of CRSwNP coming from the patient community that will share their experiences around loss of smell in the context of CRSwNP, or also called nasal polyp syndrome. One is our patient Andrew Knill from UK, Sinus UK organization, and the second patient is Mrs. Chabha Djouder from France, leading the anosmia.org organization, and both of them have been part of the EUFOREA Patient Advisory Board, and we are very thrilled to have them here today with us to share experiences on what it means to live with a loss of smell. In order to start off this Polyp Gossip, I would like to ask Chabha to share her personal experiences about loss of smell when it all started and how she felt affected by this disabling symptom. So Chabha, the floor is yours.
Thank you, Peter. Well, for me, it all started more than 10 years ago. And I have to say that it happened very much all of a sudden, almost from one day to the other, with a heavy nose congestion. And the loss of smell came right after. And it's, of course, very disturbing. And at the beginning, it feels okay because you think that, it's not going to last for so long. But when you see that it continues for, weeks and months, then it starts to become really challenging.
Was it a similar experience you had, Andrew, when you were first confronted with loss of smell? Could you comment on that?
Yeah, thanks, Peter. My experience is slightly different in that it happened very gradually over a period of time. And so a good 20 years ago now, my nose started to get worse. I later found out that I have chronic rhinosinusitis with nasal polyps. And so my smell started to deteriorate, but it deteriorated for quite a number of years in my 20s. And it sounds silly to say, but I didn't notice it as much. I was young, I was going out, I was doing things, and I had lots going on in my life. And it's only when I got my diagnosis that I realized that my smell had completely gone. And actually the worst times for it is when my smell has come back and then you realize what you've lost. And that's really tough. So over the last 20 years, I have lost and regained my smell between 5 and 10 times, I would have thought. And if I can quickly explain why that is so difficult, you have 5 senses, and those senses are what you experience, the richness that the world has to offer. If you take away your sense of smell, so your sense of taste becomes impaired. Now, that doesn't mean I can't taste salty or sweet, but if you told me there was rose in the ice cream, I'd have no idea. So really those 5 senses are down to 3 now. And also I have a problem slight with my hearing, as a lot of CRSwNP patients do. So that's 2.5 senses with which to experience the richness that the world has to offer. And I remember when I was on the EUFOREA Patient Advisory Board, one of the patients there, she described it as like seeing the world in black and white, which I just think is so true. I've heard somebody else say it's like having the light switched off. So it's difficult. It's really hard to live with it.
I understand this is a nice metaphor to express the burden of the disease and how it feels like you're living your life without a sense of smell. How difficult was it for you to communicate about the burden of this symptom to your family members and to your relatives?
I think for me, people find it very hard to understand the implications of not having it. And my mum, who obviously I've known all my life, until very recently, would still say to me, "Oh, doesn't that smell nice?" And then she'd say, "Oh, sorry, I forget." And that's a reality. People do forget. I think it's a very difficult thing for people to understand and relate to. COVID has helped that more. I mean, maybe one good thing that came out of the pandemic is I think people appreciate the impact that smell loss has, but it is hard. It's hard to explain it to people so that they understand, and it's hard for them, it sounds silly, but for them to retain that information, to understand that it's not just a thing that happens when you have a cold, but it's something that's there all the time and affects your life all the time.
Thank you, Andrew. I would like to ask Chabha if she experienced similar challenges in expressing the burden of the disease, or also communicate about the sense of smell with relatives or friends, or even your primary care physician. What have been your most challenging issues in related to smell loss?
So first of all, I was never shy about talking about the challenge that comes with the loss of smell. For me, it was very important to communicate to people around me that it's very difficult, that it impacts your life. And I was eager to explain to people how it impacts your life when you're lost. And to actually Andrew's point, it's not only losing sense of smell, but you also basically can't taste your food. So it's a heavy impact. So I was very keen on communicating to people. I have to say that in general, people understand, and it's true that pandemic helped a lot. I have a friend who told me, you know, Chabha, after COVID, I lost my sense of smell for 2 weeks, only 2 weeks. And now only I can understand what you've been going through for so many years. So, yeah, it's, and people don't always understand, and people will have, you know, this first reaction of telling you, "Oh, great, you don't have to smell, you know, like the bad odors." This is something that is coming up and that you hear a lot from patients. But yeah, what I try to do at least is to communicate as much as I can to people who haven't experienced what it is.
Okay. How long did it take you between smell loss occurring in your life and a proper diagnosis of smell loss offered by the medical community? What was your experience here, and was there any delay or lack of delay in between the symptoms occurring and a proper diagnosis of smell loss? Could you comment on that? You living in France, you may give your perception, and then I go back to Andrew.
So in my case, again, everything went pretty fast from the moment I started being sick and until I was diagnosed with polyps, nasal polyps. It went really, really fast. I went to see straight away. I went to see an ENT doctor who diagnosed the nasal polyps, and I started first treatment, you know, like the typical treatment, antibiotics and corticosteroids, right after I was diagnosed. So in my case, it went actually really fast, but it's also because everything came all of a sudden. For me, it was it didn't come gradually, so it was a heavy nose congestion, and I couldn't handle it. And the loss of smell, I couldn't handle it even for a few weeks. So I decided I will go straight to the specialist and find out what is going wrong. And this is how things went for me.
Indeed, an amazingly short disease journey, because on average it takes 8 to 10 years before a patient is receiving a proper diagnosis or a first nasal endoscopy. Andrew, how did it go in your case in the UK?
Yeah, I'm much more like the scenario you've just described, Peter. So I started to experience symptoms kind of in the early 2000s. I was young, didn't know how to navigate the health system, so I bounced in and out of the GP surgery a lot. One GP very kindly told me once he gets a snotty nose also, and sort of dismissed me kind of out the door. I then managed to have nasal surgery. My work at the time just paid for it. That was from a generalist surgeon. They were lovely, the work at the time. But the surgeon, he did surgery 6 months later, 3 months later, I'm back in front of him and he said, and my symptoms had all come back, my polyps had come back, and he said, you're just a bit sensitive, which again, really wasn't helpful. So that sent me out to the wide world. I eventually found myself at the Royal National Throat, Nose and Ear Hospital in London, which I was very, very fortunate to get to. And that was in 2008. And that's where I got my CRS diagnosis. I had a far more successful operation. I even got my smell back for a period of time after that, which was absolutely joyous. I mean, very, very quickly, I'll tell you, I was on the way for dinner to my 30th birthday dinner with my now wife at a restaurant, the best restaurant I'd ever eaten at. And I suddenly leant over to her and said, your perfume smells nice. I can smell your perfume. I could smell, I got my sense of smell back on the way to a Michelin star restaurant. And it was a wonderful thing. And it didn't last very long. And that's hard. That being shown what you could have won and then have that taken away from you is difficult. And I've had multiple operations since then. I take a cocktail of medication, and that manages just to kind of keep it under balance, so in check. But I'm much more in line with the description that you had. It took me many, many years to get a proper diagnosis, and it's still difficult now. Even the NHS in the UK is very stretched. ENT services are very stretched. So I can wait 12, 18 months between appointments. So yeah, it's still not an easy environment, even with a diagnosis.
For sharing your experience, Andrew. Did you also have at the time of diagnosis a proper smell test, or was this kind of neglected in the diagnostic workout?
No, it did at the time. And whenever I went to that clinic, they would give me a smell test. Sadly, that stopped now, as with many services in the UK, where they streamline the service and pare it back, they no longer do the level of diagnostic testing that they did. So whereas in some respects, services have got much better. I mean, in the UK here, and particularly in London where I live, we've got great ENT community services. So you can get a quick appointment, also a quick triage appointment. But when you eventually get to see an ENT consultant, which can take time, I find in my experience, they're just not doing those sorts of diagnostic testing. They will ask me about my sense of smell and will obviously work to try and help me get my smell back. But what they don't do is have any benchmarking to test where my smell is at. And, you know, that's a real shame.
It's a shame, and it's a big contrast with vision loss and hearing loss, where quantification of the symptom and the burden is really like a part of the diagnostic workout. What about the situation in France, Chabha? Can you comment on the diagnostic testing for smell loss and how your experiences have been in that area?
So I didn't have any kind of smell test whatsoever. It was all based on, you know, the symptoms and the description of the symptoms, but nothing like, you know, like how much can you smell? You know, it was, I didn't have anything like this. So I was, of course, offered to do a surgery. That was what was actually the option that I had, which I didn't do for several years because I wanted to understand why is it that I have this chronic inflammation. I have to find out what caused this inflammation. So I tried to understand through I did a lot of food diets, trying to exclude some food from, you know, what I'm normally doing. and after several months of, trying to understand, trying different options, nothing worked, nothing at all. My sense of smell was completely gone. I had not even a day or even a minute where I could smell anything. So this is only after, quite a discovery, trying to understand. So after many months that I decided to go through the surgery. And unfortunately, the surgery didn't do anything to me. It helped, of course, with the nasal congestion, but not with the sense of smell. And I have to say that for me,
sense of smell, if I may
sorry?
ask, have you in the meantime regained sense of smell, and by what means or by what treatments?
No, I mean, okay, after the surgery, yes, now I have my sense of smell back, luckily. But that was also quite a journey. So a few years back, the health system in France decided to reimburse biologics, which I got to know thanks to the association anosmia.org that I belong to. And I went to see an ENT in a university hospital. And this was a challenge because even though the healthcare system in France would reimburse the treatment, he didn't want to do it. He said, okay, maybe we can go through another surgery. I'm sure I can do better than the first one. But I didn't give up, and I said, no, I have this option. I don't want to go through another surgery. For me, this was a true trauma. I don't want to do it again, especially with the risk of the surgery not working. So I want to go through, I want to try the treatment, and then if it doesn't work, then let's see. And after not even 2 or 3 weeks under biologics, and my sense of smell was back. Basically, I always say my previous life was back. I could smell, I could taste food, and I could enjoy life, basically.
That's a wonderful story, indeed, with a happy end. So I'm curious how it ended with Andrew and how you look at it from your perspective, going through the national healthcare system in the UK, and whether or not you got also access to the novel treatment options. Could you share your experiences there, Andrew?
So in the UK at the moment, we are one of only 2 countries in Europe, I believe, that don't have biologics available for CRS. They're licensed, but they're not reimbursed. So when you're at the chronic end of a chronic condition, the severe end of a chronic condition, the only options available still are just surgery or steroids. And so I've had 5 nasal operations and one corrective surgery. I've taken more steroids than I could ever count. I was prescribed some more yesterday, in fact. And as I mentioned, my condition has gone up and down. It can be good after operation or after a long course of steroids, and I get my smell back and my nose clears, and then it just gradually deteriorates. At Sinus UK, so we've been working really hard to support the process of getting biologics reimbursed. We've done qualitative and quantitative patient research and been actively involved in the NICE committee meetings that have looked into this. And hopefully on the horizon, we will have the same experience that Chabha had, and it's great to hear that. I know it won't work for everyone, but the fact that it does work for some is a lot better than we have at the moment. And if I can very quickly, Peter, just what's an interesting point, we're talking about smell loss and how much smell loss is appreciated and the impact of smell loss. And one of the sticking points that we had with NICE is something to do with health utility values. And health utility values are a way of numerically quantifying the impact of a disease. If one is the best and healthiest you could ever be, about 0.86 is roughly what the average person in the UK will be. The higher the score, utility value score, the less likely that the NICE is to recommend this treatment, the less likely it is to demonstrate cost efficacy. And what we found is that the health utility value they were ascribing to our condition was really high. I think it was about 0.08 less than the general public. And I think that tells you a lot about how this condition is perceived. And obviously smell loss, we know through studies, is the symptom that patients find the worst. And so that's been a battle to try and persuade people that no, that's not an accurate reflection. We should have a much lower health utility value, more in line with other chronic conditions that we know through data that CRSwNP can be in line with. And hopefully then, once people start to appreciate that, the cost efficacy of treatments like biologics for CRSwNP in the UK become more realistic. And we're not there yet, but fingers crossed that we're going to get there in the near future.
Your voice and your advocacy for better care and also allowing patients with smell loss to get access to the treatment, not only registered treatment, but also reimbursement is indeed very much appreciated, I suppose, by the patient community. And thanks for sharing that testimonial. Would you agree with the current consensus of EUFOREA and trying to advocate for less and less use of oral corticosteroids for patients suffering from chronic respiratory diseases like CRSwNP or nasal polyp syndrome? We all know that smell may return as long as you take oral corticosteroids, but we all realize all the adverse events and all the burden associated with oral corticosteroids. And now we try to advocate for another way of prescribing these oral corticosteroids so that it's less prescribed and that we consider also alternative treatments that are even better than oral corticosteroids like the ones Chabha had. So what would be your idea on that? Chabha, maybe you first.
Yes, absolutely. And in my case, I mean, because I'm very much aware of the side effects of the oral treatment, I was trying to limit, and I was actually only taking them twice a year to basically enjoy summer holidays and Christmas holidays. And to your point, this is only a limited effect, right? This work for, depending on people, a few days, a few weeks. And in my case, after a few years of taking them only twice a year, it had almost no effect anymore. So, and of course, this comes with a lot of side effects. So I very much agree with what EUFOREA is doing. I think it's very positive, and we should, and this is what I'm doing actually as an ambassador with the association anosmia.org. I try to explain to people that there are alternatives to oral treatment, and try to explain what is my experience, and that there are alternatives that work for people.
Andrew, what is your opinion here on our attempt to reduce the use of oral corticosteroids in daily practice, both at primary care as well as at secondary care level? Would you agree on that approach? Or would you still say, like we in the UK, we still need those kind of treatments to have some temporarily relief of anosmia? So what is your opinion here, and what would you suggest for the future?
Yeah, I mean, I absolutely agree with EUFOREA that they should be reduced. There's a lot of data out there that shows the long-term health implications of taking oral corticosteroids. But it's a difficult balancing act, isn't it? We know, talking to lots of patients, when you're in a bad way, when your nose is so full that you cannot breathe through it, yet it's still running paradoxically, it's still running like a tap. You're sleeping on the sofa because you can't share the bed with your partner. You can't smell, you can't taste. You're fatigued and tired during the day. and you just want some relief. And we have the same experience that Chabha was mentioning. We speak to patients that they have a 2-week course. It's joyous during that 2-week course, and they're back to where they were straight away afterwards. So those patients still exist. They still need that temporary relief. And at the moment in the UK, we don't have alternatives to give them now. If and when biologics are available for CRSwNP, then absolutely we would advocate less steroids and more alternative and advanced therapies. And by alternative, I mean kind of like newer pharmacological treatments. It's difficult, I couldn't say today, no, everybody should stop them, because that's a lot of patients. We're sort of, when we're recording this, we're 6 weeks away from Christmas. I know patients that save steroid treatment up, they'll take it for Christmas. That gives them that enjoyment. They'll save it up, be in an awful state for several months, and take it just before holiday, because that gives you the relief that you're after. You can sit on a beach and relax and enjoy yourself and not have to think about the conditions and the symptoms. So I think until there are alternatives, that's unfortunately just where we're at the moment. But absolutely, to reiterate, I completely agree with your point, and I'd love to see them used less, and I'd love to see newer treatments available more widely within Europe, with the UK and throughout Europe, to mean patients don't have to take them as often.
So this is a nice final statement from your side, Andrew. I would just like to hear also from Chabha any kind of final statement which reflects ambition and also a vision on the future of care for those suffering from smell loss and nasal polyp syndrome. What would be your vision or ambition for the near future?
Well, definitely the ambition would be that, again, sense of smell is better considered by the healthcare system, that it's not considered as something nice to have. It's very impactful. It has a huge impact on your emotional life, on your psychological life. It is very important for people to understand what it means. And then again, the ambition is really for people to have the options, to be aware of what is available for them as options to treat the condition, and to have access to these treatments.
This is a wonderful final statement, and I thank you, Chabha, as well as Andrew, for sharing your perspectives, your disease journeys, as well as your vision and ambition for the future. And I see both of you keep on smiling, so we all think the future is bright. And we all experience now revolutions of care in the field of nasal polyp syndrome, with more treatment options, with better outcomes, with still some challenges in relation to the timing of treatment, in relation to surgery and in relation to other treatment options. So we are experiencing a very dynamic period, and I'm so happy with this initiative of nasal Polyp Gossip, where we can not only share these experiences, but also discuss the real unmet needs with you, patients coming from the UK and from France, also with the other patients of the Patient Advisory Board of EUFOREA. And if you agree with me, I think the future is bright, and we should keep on talking about nasal polyps, nasal polyp syndrome, or CRSwNP, whatever you would like to name this condition. But I would like to really thank you, Chabha, thank you, Andrew, not only for joining us today, but also for your major efforts in bringing the voice of patients to the larger audience, to the public, and to the health policymakers, that will hopefully make a meaningful change for the good of our patients suffering from CRSwNP. So Chabha, thank you so much. Andrew, thank you so much. And I kindly invite you and also all the listeners to this Polyp Gossip episode to keep on talking about nasal polyps, and also join us for any of the next episodes. And I can tell you the next episode, we will have wonderful experts from the United States that join us and share with us their latest insights into the pathology, the science, and also the real life experiences in CRSwNP. So thank you for having joined us for this episode, and looking forward to the future. Polyp Gossip.
This was Polyp Gossip, sponsored by Sanofi Regeneron and developed in close collaboration with EUFOREA.